Constipation is one of the most common complaints I see in my daily gastroenterology practice. For most people, it is nothing serious. However, in a small number of cases, chronic constipation might be the early sign of colorectal cancer. In this video, I will show you how this patient's constipation turns out to be due to colon cancer. So this is a video of a colonoscopy, which is the camera examination through the back passage. As you can see that this is all very abnormal. So there is a growth in the rectum. So this patient has been having problems with not able to pass the stool. The stool he was describing as thin like a pencil, because you can see there is a growth in the rectum. So there is a small opening here. So obviously every time he's trying to pass the stool, it is getting a bit stuck. So only small thin pencil-like stool is passing through. So this patient has been having constipation for a long time. However, recently it has got worse, and he was also having a slight issue with the blood count, the hemoglobin going down gradually. As you can see, there is already some signs of bleeding. So he was having intermittent small amount of blood as well, but his primary complaint was that he was not able to pass the motion freely. The stool was getting difficult day by day. Abdominal pressure he has to apply a lot. And every time he went, there was only small amount of stool coming, and then he was feeling bloated and heavy for the rest of the day. So there is a large tumor that we can appreciate here in the rectum, and you can see that this is all normal part and this is the abnormal part, and it's already narrowed. So which is why this issue where he's struggling to pass the stool. So we will now have to take some biopsies. So we will be taking samples from this area. So from my clinical experience, we can tell that this is a rectal cancer. So we will have to take samples to check this with under the microscope and confirm that this is a rectal cancer, what we call as adenocarcinoma, and the pathology doctor will look at it and give us the confirmation. But we have an answer as to why this 55-year-old gentleman has been struggling with constipation, why he is not been able to pass the stool freely of late. Constipation is not simply about not able to go daily. Even if you're going fewer than 3 times in a week, you might be going daily, but you're straining excessively. You're passing hard, lumpy stools. Sensation of incomplete evacuation, which means you go, but you don't get the sense that it's completely cleared. Your symptoms are going on for months. Occasional constipation anybody can get, but if it is persistent, if it is getting worse, then that is not normal. Colorectal cancer is among the leading causes of cancer-related deaths in the world. Increasingly, there are more and more people getting diagnosed under the age of 50. So there is changes in the diet, sedentary lifestyle, there's not much physical activity, urbanization. India is certainly seeing a definite increase in the colorectal cancers, particularly in the cities. So how can colorectal cancer cause constipation? It develops gradually over months and years. It starts from a small polyp, tiny growth in the colon, so slowly gets bigger. So the intestine itself starts to get narrowed, as I just showed. It alters the movement of the colon, so it results in a temporary blockage. As the tumor, the growth starts to get bigger, the stool starts to have difficulty in getting through. So many people think that they have to rely on pain as a symptom of cancer. So there are certain features with constipation that can increase the likelihood of there is a serious problem. One, it could be a new onset constipation that you never had it before if you're aged 40 and above. If you're losing weight, if the blood count is going down, or if you're passing blood in the stool, or there is a change in the stool caliber like a pencil thin stool. If the abdomen is getting distended, persistent pain. So pain is not always the feature of colorectal cancer. A lot of people have constipation which is managed usually by diet, their lifestyle, but there are other reasons. Sometimes there can be narrowing in the colon, there could be a lot of diverticulae, pockets in the bowel that can cause constipation. There can be issues like underactive thyroid, increased calcium levels. So all of this can result in constipation. So when we say constipation, it doesn't always mean cancer, but cancer is one of the main worries. So that is something that we need to be vigilant about. So the best way to tell whether or not there is anything in the colon, anything serious in the colon causing constipation, is by checking with a colonoscopy. Colonoscopy allows us to directly look into the large intestine, obtain samples, biopsies like just you saw in the video. And it can also be preventative because you can remove polyps, which can reduce the risk of developing cancer in the future. So colorectal cancer, if you detect at an early stage, it has got excellent outcome. Early stage survival is very high. Irrespective of the age, colorectal cancer is one of those cancers where the prognosis, the treatment options are plenty, but you should always try and seek medical attention early. So if you have got new onset of constipation beyond 4 weeks that is associated with those kind of warning signs what I mentioned, then you should seek medical advice. What steps can one take to prevent colorectal cancer in the first place? Because this is very, very important. Of course, prevention is always better than cure. There are things that one can do: high fiber diet, adequate hydration, regular physical activity, avoid using laxatives routinely. Most importantly, screening for polyps. So above the age of 45, if there is a family history, certainly no age is exempt. If you have got family members with colorectal cancer, then you should get screened, because screening with colonoscopy can save lives. Because what happens is, when we see polyps, they take 5, 10, 15 years for the polyp to turn into cancer. So during colonoscopy, these polyps can be removed safely, and thereby this can reduce the risk of their cancer in the future. So it is one of the fantastic tools that we have to prevent cancer. Colorectal cancer is preventable, it is treatable. There is even at the age of 90, it responds to the treatment. So no age is too old for treating colorectal cancer. People dismiss thinking that it is an age-related problem when somebody's constipation is getting worse and worse, and we have to be vigilant. Not, of course, all constipation is to do with anything serious. So we should do things that, there's 3 things that one should do. Firstly is checking, am I taking adequate amount of fiber? Because fiber adds bulk to the stool, so that we get from variety of vegetables, fruits, whole grain foods, nuts, seeds. So second thing is not just taking fiber. If you take too much of fiber and don't supplement with water, you will get a blocked feeling inside, bloating, cramps, gas. You need to ensure that you are taking adequate amount of water, because I see so many of my patients, sometimes they're using all these chia seeds, flax seeds, but not enough water. So you need to ensure that if you are somebody who is prone for constipation, whose bowel habit is a bit sluggish, ensure that you are drinking at least 3 liters of water. The third one is the movement, the physical activity, because that is one of the biggest stimulators of gut motility. If we are lazy, our intestine becomes lazy. So the more active you are, the digestion, the gut motility also improves. So these are the 3 things that one should do, and they should do. Of course, if you are consuming foods that is all refined flour like maida, bakery product, and relying on a lot of junk and outside restaurant eating, there won't be much fiber you will be getting. So it's important to address that you are meeting the fiber requirements, meeting the water requirements, and also you're physically active. So these colorectal cancers are preventable cancers. So we need to really focus on the lifestyle. And despite your lifestyle, despite doing everything right, if the constipation is getting worse, or if you got other symptoms, or if you have any doubt, see your medical gastroenterologist. Thank you.